30th SuSanA meeting, we have shared various planned and ongoing initiatives linked with COVID-19. This year, therefore, this session is designed to share the progress of those initiatives led by different partners. So you'll be hearing much of the progress that we have committed last year or any initiative initiated last year. Next slide, please. So our collaborators for this event will share insights, and that is detail about their initiatives, its progress, and learning from ongoing behavior change work for COVID response, followed by we'll have the opportunity to discuss on specific topic on changing behavior for generation. So you'll have the opportunity to ask question to the presenter in the chat box. So presenter will actually answer and respond as we go through the session. And you can also participate into the focus discussion towards the end. So start thinking from now on how your current and future intervention will contribute in changing or sustaining the behavior for a generation, not only for you, but for all, not only to this generation, but for generations, not only in one settings, but in all settings in a sustainable manner. So once again, welcome and thanks for joining for today's session. We will spend 90 minutes together. As you can see into the agenda, we have series of presentation first and followed by we'll have the group discussion. Next slide, please. So at this stage, without further ado, let me invite our first speaker from UNICEF, Ms. Janita Bartell, and she will present Hand Hygiene for All initiative and its one-year progress. So basically, over to you, Janita.
Hi, thank you very much for inviting me to speak here at this session and share some of the work that we've done and some of the thinking around hand hygiene and supporting the behavior change that is ongoing. Before I start, I just want to emphasize that I'm really just a placeholder for my colleagues Nat and Joe from UNICEF and WHO respectively. Many of you will have not known them or come across them. They're together leading the global coordination of the initiative, but they're currently both on well-deserved annual leave. The Hand Hygiene for All initiative. Many of you will have heard about the initiatives, not just about Nat and Joe. So apologies if I bore you with the basics. So in a nutshell, the Hand Hygiene for All initiative builds on the unique opportunity that hand hygiene has during the COVID-19 response. We have seen the need for improving hand hygiene across multiple settings, including healthcare facilities, schools, and households, so our classic settings, but also workplaces, transportation hubs, places of worship, market, basically everywhere where people come together and germs spread. Country level is at the core of the initiative to bridge between the COVID-19 response and longer-term development plans. And through this global initiative, UNICEF and WHO bring together a group of partners around a shared vision, working collaboratively with key international organizations, national and local governments, development banks, NGOs, entrepreneurs, employers, civil society, academia, etc., you name it. You can see the logos of the core partners here at the bottom of this slide. As public health practitioners, we know that hand hygiene is not just important for combating the spread of respiratory infections such as COVID-19, but for reducing a whole range of other infectious diseases such as cholera, hepatitis E, neglected tropical diseases such as trachoma, healthcare-associated infections, and of course, diarrhea. This makes hand hygiene a no regrets investment in response to COVID-19 and for public health safety in general. We think about the time ahead in three phases. The response phase that in many contexts we're still in the very middle of it, although in some countries where vaccines rollouts have already begun, we feel like we've moved beyond that. Response phase focuses on hand hygiene as part of controlling the outbreak by prioritizing hand hygiene in healthcare facilities, schools, and public places. The rebuild phase focuses on identifying and filling critical gaps in policies, monitoring, financing, capacity, and innovation based on the lessons learned from the COVID-19 response and prior to the response. And finally, in the reimagine phase, hand hygiene is institutionalized and sustained through a strong culture of hand hygiene for public health, but also in preparation for the next local or global outbreak. Hand Hygiene for All initiative is set up to support countries along this journey from response to reimagining. And the first step for countries will be to develop national roadmaps that map out this. At the country level, the initiative has been advocating for countries to lay out this path for hand hygiene for all until by 2030, in line with the SDGs. And we have given this call a bit of a structure because even the best behavior change interventions needs adequate and equitable access to products and services and an enabling environment. So costed roadmaps outlining practical, achievable actions and milestones to address hand hygiene in a comprehensive, sustainable way. This is what the initiative is advocating for, and many countries have picked up. Some of you will have seen the presentation of Bangladesh during the Global Handwashing Day celebration last year in October. So what have we achieved in the last year or so that this initiative existed? We've seen some tangible progress in hand hygiene at both country level and at global level. At country level, you see this here on the left. 16 countries have started to work on developing national government-led hand hygiene for all roadmaps, and an additional 8 countries are planning to do so soon. Some countries here in blue have taken a bit of a different road and strengthened hand hygiene within existing policies and strategies without developing a standalone roadmap for hand hygiene. You can see here the small picture on the bottom is our very first hand hygiene for all roadmap, which Pakistan has just published a few weeks ago, laying out their path to hand hygiene for all by 2030 as part of the Clean Green Pakistan initiative. At global level, activities have been structured around 5 accelerators of the SDG 6 acceleration framework, and the 5 accelerator that this framework outlines, you can see here on the left of the right side. So to highlight a few, we're working on the State of Hygiene report, which will be launched for Global Handwashing Day on October 15, which summarizes the current state of hand hygiene, analyzes trends, and gives the direction where we need to go as a sector to address gaps. UNICEF has worked with the World Economic Forum and a couple of private sector partners to put together a hand hygiene market accelerator to address some of those supply gaps in innovation and supply chains and building resilient markets for hand hygiene to come. We have, in terms of capacity development, we have developed technical guidance for country offices and partners for roadmap development, and the Global Handwashing Partnership at the moment is engaging in a capacity assessment. They might be speaking about this later. And the costing tool, also to highlight that, it's a relatively straightforward Excel sheet with the best currently available evidence. You can plug in costs in your local context, and it will return to you an estimate of what it would cost to reach everyone without access to hygiene on an annual level and until you reach 100%. And it factors in the hardware, so hand washing stations, soap, water, etc., but also the behavior change components and pricing. So it's not just nice to have a roadmap, but you actually have an estimate of how much that will cost. With that, I would like to end this presentation here. Thank you very much for the invitation. It's really exciting to open this webinar on behavior change with a more comprehensive view on placing behavior change within sort of the wider system to make sure it's not just put on the individual to just please wash your hands, but behavior change is supported through a structure that everybody buys in, and it's everybody's business. So as we say, it's a whole of society approach. Thank you very much.
Thank you, Janita, for the presentation. Of course, an Hygiene Fall initiative is truly a global initiative, working with the national government to develop the country roadmaps, costed country roadmaps. Of course, only the programmatic roadmap is not going to be enough. We need costing together. So hopefully, the country will come up with the costed plans, and then collectively, together with the government, all the partners will actually contribute to the whole of society. Thanks for that presentation. So our next presentation is from WaterAid. So I'm going to now put my WaterAid hat on me. So I will be presenting on the multi-country hygiene response to COVID-19, learning from our scale operation to the evaluation. Can we go to the next slide? So yes, yeah, let's go to the next slide. WaterAid, yeah, next slide. So WaterAid as an organization, since the beginning of the pandemic, we have put hygiene behavior change as first line of defense to COVID-19. Then we started operating and responding COVID-19 at a scale with a specific approach all across of our many countries. So my today's focus will be what was the scale of the what was the scale and approach of our COVID response to hygiene response to COVID-19, then what was the learning throughout the process? What have we learned from our scale response? So as I said, so we have operated in 26 countries, responded COVID-19, targeting 99 million population. It was over a period of 12 months initially, but then some of our country program is still operating, responding to COVID-19. We're operating in multiple settings, including households, community, school settings, healthcare settings, public places, and public institutions. We have used the simplified version of the behavior-centered design approach. When I say behavior-centered design approach, we started looking the context at the beginning, develop design principle, define target behaviors, and develop a theory of change.
Good evening, my lecture.
Colleagues, if you are not speaking, would you be able to mute your microphone, please? Thank you. Great. Once we have done the assess step, I mean, due to the various reasons, we are unable to conduct the formative research, but then establish a creative process to design the intervention based on the quick insights. Then our intervention was delivered through multiple channels. I'm going to focus on that subsequently. And the effect of the intervention was evaluated through the midterm rapid assessments. I'm going to highlight the brief insight on that as well. So throughout the pandemic, we have focused on 5 key hygiene behaviors, including hand washing with soap, respiratory hygiene, including wearing mask, maintaining physical distancing, and stay-at-home message. We focus on using multiple motives in order to change the behavior of the people, including fears as a temporary stimulus, but more specific focus on affiliation, nurture, pride, and disgust linked with virus. And our desire from this multi-country initiative was to improve awareness. For some of the behavior were new, therefore improving awareness, but primarily focusing on behavior change. So changing behavior, building hand washing facility, and establishing a sector coordination in order to contribute in reducing the spread of the virus. Next slide, please. Before COVID pandemic started, we already had the country-led, government-led, in many cases, WaterAid-supported hygiene behavior change program on the ground. So we have actually leveraged those ongoing large-scale behavior change program in order to bring COVID behavior into those ongoing programming. So we actually leverage the existing platforms. For example, we have Ideal Family Campaign in Nepal, which is hygiene into immunization program in operation, Clean Green Pakistan, Clean Campaign in Nigeria, which is in Bauchi Strait, Kutuba Campaign in Zambia, Helenteka Campaign in Eswatini. So those were already an ongoing program. We actually leverage them in order to bring the COVID response into those programming. Next slide. In this slide, you can see what was our operational modality and what was the progress. So throughout the pandemic, we have used do no harm approach. So therefore, majority of our delivery touch points were through non-contact methods. So hygiene behavior change through mass media, digital and social media, non-contact methods was our primary focus. And through that initiative, we have reached 181 million population. The second, we have also installed hand washing facilities in public places. So we have installed 2,700 public hand washing facilities. Majority of them were paddle operated, hands-free, inclusive facilities. In order to change the behavior, only changing script in people's head through motivations and installing facilities is not enough. So therefore, we have also put visual cues, nudges, and reminders through social media. As you can see some of the nudges there. Together, we have also distributed 1.8 million hygiene products. I mean, ideally, in a normal behavior change program, we don't distribute products, but this is an emergency scenario, particularly in public places and when there is a need, particularly for those that are need. We have distributed 1.8 million hygiene products with the support from multiple donors. Those were like crux of the program. Then, of course, our sector engagement was high. We have continuously supported for sector coordination mechanism. We have participated in WAS and health clusters in various countries. We were also part of in various collaborative initiatives, including a core partner in Hygiene Fall initiatives, in the steering group in Hygiene Hub, and then HBCC initiative as well. Next slide, please. So in a nutshell, I'm going to show you 2 minutes video. In this video, you will see what exactly is happening into the country. So video, please. So that's the overall program in nutshell, the comprehensive progress that what we have made. In next slide, please. In next slide, you can see, I just would like to highlight, so that was the crux, but within the mass media, digital and social media, the few points I would like to highlight here, the whole plan was to expose people multiple times with repeated frequency. So therefore, we try to make our intervention more progressive. Because there were some new behaviors, example, wearing a mask, maintaining physical distancing, those were totally new to the sectoral people, even like entirely to the global population. So therefore, our assets, the television, the radio, miking, the loudspeakers, then also other social media, any assets or materials actually started with the knowledge focus and the science base at the beginning. And subsequently, we have then uplifted there to make it more emotional so that it are attractive to the people, it triggers people interest. But then subsequently, we have seen that trust was quite important because there were lots of myths were going around with the COVID-19. So then we have improved those, the mass media assets, focusing on using celebrities and comedians and national heroes to make them more trusted, and also working with the government branded trusted campaign. So there was a shift throughout the pandemic. You can see people who were exposed multiple times with multiple delivery channels. Next slide, please. In addition to the mass media, we have also done a community-based intervention. The crux in the community-based intervention are exposing people with an event. Of course, conducting a massive event and crowd was not possible throughout the pandemic. Where possible, maintaining the COVID safety measures, wearing masks and maintaining physical distancing. We have run some session in schools, healthcare facility, workplace where possible. In some countries, we have also integrated hygiene into COVID vaccination program. For example, we have integrated hygiene into ongoing routine campaign and COVID vaccination campaign in Nepal, and supporting the South African government on the same together with UNICEF there. Next slide, please. So as you have seen into the video, the crux on the hand washing facilities. Initially, we have started responding very quickly, and in some places we have also installed temporary facilities, but with its own life cycle. In some countries, in Bangladesh, for example, we have even put a hand washing station in Wheel. You can read this the detailed case study through Hygiene Hub as well. In many countries, then subsequently we then upgrade all of these facilities into either in semi-permanent or permanent facilities. We are still improving it. Our second phase of the campaign is primarily focusing on installing the permanent and semi-permanent hand washing facility rather than temporary, because it does require daily operation and maintenance. Otherwise, these facility will become and white elephants for us to cover. So our learning is basically moving from temporary to more on permanent and the semi-permanent facilities. The next slide, please. In order to assess whether our intervention was effective throughout the pandemic, because we have started responding without any baseline, then once we start responding, we realize that there is the lack of data, the real-time data to make our intervention more progressive. So therefore, we have done a midterm rapid assessment in between in collaboration with London School Hygiene Hub and also Rana's colleagues. The midterm rapid assessment in 8 countries. We have assessed, there were a couple of different assessment tools that we have used. One of those were household survey in 3,500 households in 8 countries. The preliminary assessment from the midterm rapid assessment showed that the intervention has a higher reach. I'm saying that the assessment was done in order to understand the sectoral the outcomes rather than WaterAid specific. But WaterAid also contributed is because this assessment was done in an area where WaterAid operated. The assessment shows that more than 93% people actually were hearing or seeing the hygiene preventive messaging through their delivery channels. Top 3 behaviors they were hearing were hand washing with soap, wearing mask, and maintaining physical distancing. Majority of the people were hearing all of this through televisions, radio, health workers, and social media. And top 4 motives people were saying is fear, nurture, affiliation, and pride. As you can see here into the table, the intervention were somewhat influential or effective in terms of improving the knowledge and reported behaviors. And majority of the people said that they started practicing those behavior due to exposure with the intervention. And we have also asked people whether they have seen other people into the community started practicing the behavior. More than 50% people said, that we have seen practicing the behavior. But then when you started looking the statistical analysis, working with London School subset analysis, we have seen that there is a significant improvement in knowledge and reported behavior on certain critical points for hand washing. For example, the ritual critical moments for hand washing after defecation and before eating. But then there were some critical moments where the COVID sensitive moments where the hand washing also need to be practiced were quite minimal. So our conclusion were the second phase of our campaign therefore should focus on a specific moment for hand washing rather than on the general, oh, wash your hands. That will not have a specific outcome. So that was the learning, and we have used this evidence to inform our ongoing response. Next slide, please. Finally, this is my final slide, final conclusion. What have we learned from such a massive scale response in 26 countries and from our evaluation? 1, science-based response. So what we have done, we have targeted disease-sensitive behavior, 5 key behaviors. We never deviate from this. We always focus on 5 COVID-sensitive behavior. We have used applied rapidly on the behavior-centered design approach, because applying behavior-centered design approach help us to curate more emotional, attractive, and context-specific intervention. And it is even possible to generate those. Second, mass media. Of course, through mass media, we can reach many people multiple times with a repeated frequency. But what we have learned, we need to make those assets more trusted. So therefore, use of celebrities, influencer, and branding with the government was quite essential. The asset and package need to be all in local language. It has to be more context specific, and it has to be progressive. Otherwise, it will saturate the campaign, because if you are constantly delivering the same television advert over 15 days, it will saturate the campaign. So therefore, multiple assets are needed in order to avoid the saturation of your campaign. The diversity in asset is needed because we're targeting multiple target population. If people see, let's say if students see themselves into the advert, they will link, oh, this is for me. Otherwise, it will not be target cohort specific. So therefore, the diversity in the asset is important. So that's the learning. Community-based intervention, of course, it was effective, but at a small scale. It was trusted, focused, limited space, to conduct the hygiene session. But what we have learned is the mass media focus intervention followed it by the community intervention has more effect. Hand washing facility. Contracting takes times because local contractor takes a lot of timing, and contracting them also takes time. So we need to have the context specific design already in hand if we are responding into the pandemic. Ideally, permanent and semi-permanent facility need to be installed because it does require daily operation and maintenance. Visual cues and nudges has to be together. It has to be attached. Longitudinal monitoring is quite essential. Coordination and partnership is quite ideal. Coordination with and implementing this through government leadership while implementing a large-scale behavior change program is quite vital. Cross-sectoral coordination is vital to minimize duplication. We have seen lots of duplication into the sector. We tried our best, but we still see some duplication in terms of multiple partners working on this. Partnership with private sector is quite important to bring innovation on product innovations and design. Inclusion. We need to be intentional to use the E&I framework at the start, not at the later stage. Involve DPOs at the beginning in the design to ensure the packages and assets are quite inclusive. From the evaluation and monitoring, the timely generating evidence, it was quite helpful to make our ongoing response more progressive. So that's what we have learned. And then because we have centrally standardized tools and methods, therefore country were easily replicating those in order to generate evidence. And centralized the standardization of tools was also helpful to cross compare the data for us subsequently. In terms of sustainability, because we have used the existing campaign were available, so therefore it was easier for us to integrate the COVID sensitive intervention there. And also while exiting, we're going back into the new normal with making existing campaign COVID sensitive. System strengthening is quite important. Even if in the emergency, let's focus on system building the capacity there. But mass media campaign, because we have run through in a scale fashion, so we still need to monitor the sustainability of these intervention over time, including the hand washing facility sustainability. Enabling environment is quite important. So therefore, having that national plan, national financing is quite important even during emergency. Those countries where the plans are already existing, it was easy for WaterAid to work with the government to implement those program at scale. Next slide. With that note, I will conclude here. Yeah, thank you for listening. If there are any questions, happy to chat as well subsequently. With this note, now I'll pass on next slide to colleagues. Sorry for marathonic presentation, colleagues. I think you'll hear a couple of presentations, and towards the end, we will go for the Q&A and the discussion session. For the second next session, so I'll like to invite Ms. Lisa Rudge from FCDO. She will be presenting on Hygiene Behavior Change Coalition Initiative in multiple countries and its key achievements. Over to you, Lisa.
Thank you for that. Hello, everyone, and thank you so much for the invitation to present the achievements of the Hygiene Behavior Change Coalition today. So as Om said, my name is Lisa Rudge. I work for the Foreign Commonwealth and Development Office in the UK. I've just recently moved from Mozambique, and I'm delighted to join this amazing coalition and present some of its achievements to you today. Many of you in the room, I think, will be familiar with the HBCC and probably implementing it. So thank you very much for your patience while I take you through what it is, what it's done, and what it's achieved. Can we go to the next slide, perhaps, please? Yep, and the next one. Great, thanks. So the Hygiene Behavior Change Coalition was set up by Unilever in the UK in March or April 2021. It was really designed as a rapid response mechanism to contain and limit the spread of COVID-19 amongst vulnerable populations in low and middle income countries. So as you can see, it builds on the partnership between Unilever and FCDO and took that partnership to a whole new scale. It combined £50 million or almost £50 million worth of public funds with £50 million worth of Unilever's in-kind support, expertise and management capacity. But the coalition, as you can see on the screen, is also made up of 21 partners. The logos are here, and they and that also includes the London School of Hygiene and Tropical Medicine, who run the Hygiene Hub. And I believe Robert will say a bit more about that later, so I won't go into too much detail. So just to say that this incredible coalition operates in 27 countries through 78 projects. It's massive. It brings, so I've already said that, but it brings together, I think, the Unilever's unique expertise, its reach and supply chains, and the vast experience that the NGOs and UN partners bring to the wash sector through hygiene and behaviour change communication, but also because they're strongly grounded in communities across the world and thus able to reach some of the most vulnerable people. And bring together, and the coalition really brings this all together. Can we move on, please? Thanks. The coalition's overall aim is to improve hand washing with soap and other COVID-19 practices mentioned previously by my predecessors, so mask wearing, cough etiquette, surface hygiene and physical distancing. It also has supported national COVID-19 responses in countries where the HBCC is operating, and supports infection prevention control in health facilities as well. So partners, and here on the slide you can see lots of different pictures from partners, have really designed large-scale digital media and social media behavior change communication interventions that were really adapted to the context they operate in, both in terms of the COVID-19 pandemic, but also and to the prevailing norms, knowledge, attitudes, and behaviours related to hygiene and the COVID-19, as I think really well mentioned by in the previous presentation. Other activities included training of key influencers and agents of change who are trusted by communities, but also a lot of work on evidence, sharing of best practices and building the case studies. So a real science-based approach as well. Using community voices through religious leaders and community health workers was also essential. Partners also distributed hygiene products, provided hand washing infrastructure, and in some cases water and sanitation infrastructure in communities, in busy public places, schools and health centres and communities. Next slide, please. So here are some numbers. These are numbers which have been compiled up to April 2021, so not fully up to date, mainly because of the huge task of compiling the results of all these numerous partners. I think you might have heard in the press, but also in the HBCC's communications, that the coalition has reached up to 1.2 billion people with hygiene and COVID-19 prevention messages. So that's absolutely massive. But just a word of what that actually means. So these reach figures reflect the number of people who were reached by partners through through different medium. So it could be TV, it could be through radio, and it's likely that that these people were reached by several media. So it's not a measure of unique reach. I just wanted to make that clear, but rather a reach of a number of people who have received different types of messages, either through TV, radio, or community engagement. So given the pandemic, obviously reaching different groups was absolutely essential through a range of behaviour change communication channels. So online and digital media obviously can be a powerful tool and definitely help to reach scale with this programme. However, of course, it's not appropriate in all contexts and for all populations, and face-to-face communication was also necessary to ensure broad and inclusive reach, including in IDP and refugee camp settings. Through Unilever's in-kind contributions, you can see 78 million products were distributed, 140,000 healthcare community leaders, carers, teachers were trained, and over 10,000 healthcare facilities supported. Next slide, please. So beyond the numbers, we've already heard a number of lessons learned, and I think the achievements of the HBCC go well beyond the numbers that were shown. although they are impressive, of course. I think the coalition and the creation of the coalition and its implementation capacity has led to huge learning, many captured through the Hygiene Hub, but it's provided also a ground for learning, implementing and testing approaches, which I think was really important. I think also there has been incredible work done in designing and delivering interventions based on understanding the local knowledge, the beliefs, the behaviours, the fears, and really using behavioural science to design those interventions. Providing accurate information was also absolutely critical in order to tackle any misinformation or fears or misunderstandings. I think the strong focus is a reminder as well to us all, and including to donors and many others, of the importance of hand hygiene, and also to a wide range of other diseases as we look to the future, of course, as well, and think about how to sustain these hygiene practices. This was all mentioned by Janita in her first presentation, so I won't go too much into detail. So I think another lesson for me is also that the coalition has achieved so much through its model, through the strength of its membership, and the strong basis and anchor in evidence. Coordination with governments and amongst partners in countries was also critical in order to deliver those interventions. For the FCDO in particular, it also mobilized our diplomatic and development network, supporting the HBCC where possible, which in the context of this new organization recently merged is really important to see how we can work better and use that whole network better to support such initiatives and messages at the country level. I think the Hygiene Hub webinars, the COVID-19 Behaviour Change Forum also helped informing interventions in a constantly evolving context. And that was particularly important so that, as we already heard, the behaviour change interventions could be adapted as new information was available, or tackling information fatigue or misinformation. I think another great achievement is that it reached some of the most vulnerable people across the world, paid particular attention to people living with disabilities, and adapted infrastructure, but also targeted messaging to the specific needs of those and other disadvantaged groups, including IDPs and refugees. And finally, and perhaps more recently, partners have also evolved the behaviour change communication material and approaches to tackle vaccine hesitancy, to prepare and support vaccine acceptance and rollout. So what's next? I think quite a few HBCC partners are still undertaking some evaluations and outcome evaluations of the work that's been done. The London School is carrying out a process evaluation, and there's also an evaluation of disability inclusion of the approach through some of the partners through a separate funding mechanism. So I look forward to hearing about all of those learnings and hopefully share those more widely in future. And just would like to thank everyone on the next slide for listening, and also all the HBCC members for their incredible achievements on this program. Thank you very much.
Thank you, Lisa, and greatly appreciated. And it was a hugely impressive initiatives altogether, and I think one of the biggest in the history history of hygiene into the sector, I would say. Thanks very much for these hugely impressive coalition, hygiene behavior change coalition initiatives. With that, colleagues, if you have any question to Lisa, please do type into the chat box. We will not have time to respond now, but I think colleagues will continuously typing into the chat box subsequently. Thanks, Lisa. So I'd like to now move on. So our next presenter is Dr. Robert from London School of Hygiene and Tropical Medicine, and he will be presenting on COVID-19 Hygiene Hub and its one-year progress. As Lisa also mentioned, the Hygiene Hub is doing an incredibly good work. So over to you, Robert, to highlight and inspire us. Over to you.
Thank you. Thanks. Okay, so hi everyone. My name is Robert Dreibelbis. I'm with the London School of Hygiene and Tropical Medicine, and I'm also the director of the COVID-19 Hygiene Hub, which is a London School of Hygiene and Tropical Medicine housed initiative, but we bring together a large number of technical and implementation partners. We've been providing technical support and guidance, or not guidance, just general technical support since the start of the pandemic. So I wanted to talk about some of the accomplishments of the hub and some of the lessons that I think we've learned and that are can extend well beyond just the Hygiene Hub itself. Next slide, please. So the Hygiene Hub is a service to help actors in low and middle income countries rapidly share, design, and adapt evidence-based hygiene interventions to combat coronavirus. Now, we have three pillars with which we work. One is providing resources that organizations can use. The second is providing technical advice or technical support to organizations. And the other is connecting with others. And I do think it's important here, particularly within the context of COVID-19, we really do run the gamut from everything from hand washing with soap to social distancing to social protection programs. All of that falls under the broad umbrella of hygiene behaviors as responding to COVID-19. Next slide, please. So as I mentioned earlier, we are a broad coalition of partners that are working under the umbrella of the COVID-19 Hygiene Hub. We have a pool of technical advisors. These come from organizations scattered throughout the world. We have, for London School of Hygiene and Tropical Medicine, we have leading institutions from Bangladesh, Kenya, Malawi, Zambia, the United States, Canada, just a whole global network that we really are relying on for kind of the technical support that we provide. And we also have a global steering committee leading with many of the leading global NGOs that kind of provide, that are shaping a lot of the discussion around this, multilateral organizations. I won't go through all of them. You can go to our website and all of these are listed in a lot more detail. But just when I say we as the hub, I'm referring to this broad network of people, not just myself. Thank you. Next. So our first area that we've been working is on technical resources. Now, I'm not going to go through the names of all of these, but we've produced over 200 technical resources since the start of the pandemic. The goal of these resources is to provide both a synthesis of the evidence, which we realize within the COVID-19 pandemic, that evidence is rapidly changing and can be rapidly evolving. So particularly views, for example, on the role of surface disinfection and how that plays a role in transmission. That's an area where we've had people routinely updating information, responding to WHO and global guidance on how to deal with specific behaviors, and then providing a particular focus on how to translate these new guidelines or new evidence into simple, practical, evidence-based solutions. Now, one thing to note here is that all of the resources that we produce, all 200 of these, we make available. They're written in English and developed, but almost immediately translated into French, Spanish, and Arabic. Next slide, please. So these resources, there have been a lot more use of these resources than I think any of us had initially anticipated. We've had over 25 contributing authors and 83 different reviewers who have contributed to these. So a big thank you to anyone who's been even remotely engaged with the development of these resources. So far, since the start of the pandemic, the resources that the Hygiene Hub has created have been viewed 183,000 times. And the number keeps kind of going up. Not sure if everybody is getting that static. Okay. One click, please. And this is kind of how those resource views and how that use has changed over time. I mentioned earlier, we make all of these resources available in multiple language. Starting first in November of 2020, our Spanish language, our Arabic language resources were read more than our English language resources. And that's continued. It's kind of since, so for the better part of our existence, more of the resources that we've used have really been used, either Spanish has been particularly popular, the Arabic resources have been popular. We've also had a limited number of resources that we've been translating into Portuguese for colleagues in Brazil and Mozambique and other Portuguese-speaking countries. One click, please. So I think a big key lesson here is that there really is high demand and something we all need to think about when we think about providing technical support and providing resources, that there is high demand for practical non-English language resources. The more we can do to make sure that anything our organizations are producing are accessible globally to various populations, it's really going to help us in the long run kind of learn as a community. Next slide, please. So I mentioned we provide technical support. There's various ways that one can do that. We provide real-time technical advice on our website, similar to a chat function, as if you're kind of on a corporate website. It's the exact same technology. We just use it so that one can kind of engage with our team of technical experts. We also provide tailored ongoing technical support across the full policy and program cycle. This can be coordinating with other actors, understanding challenges, designing a response, implementing the response, gathering feedback and evaluation, and learning and adapting for future response. Now, it's all of these interactions that actually inform the resources that I just developed. So once we have enough significant interactions with partners about a specific technical need, we then make sure that we've prepared kind of practical, useful resources that can help guide programs on this. Next slide, please. So far, we've provided this rapid technical support to over 150 organizations in 63 countries through our broad network of technical partners. We've had over 70 different in-depth technical collaborations with organizations. Earlier mentioned some of the work that we've partnered with WaterAid on evaluating their midterm evaluation strategy, but we've had this with over 50 organizations since the start of the program, since the start of the Hygiene Hub. And about 2/3 of these initiatives are really focusing on country level or country specific or national level programming. One more click. So our key lessons from here, and when we think about behavior change in response to COVID-19, the technical needs and the technical requirements of a lot of our partners have changed significantly over the pandemic in response to various kind of things. As Lisa mentioned in her discussion about the broader HBCC, there's quite a bit of focus currently on vaccine integration and overcoming vaccine hesitancy. This is a shift from earlier where many people were trying to find resources on sustained behavior change. We've been able to meet a lot of these kind of needs or work with partners on these because of our responsive nature. But thinking ahead to future pandemics, I think we need, or anything similar, we need to understand that these needs are going to change over time, and we need to be responsive to those changing needs. The kind of second point is, when we really started the pandemic, or as needs have changed, as new behaviors has become paramount, particularly kind of early, in the start of the pandemic, people were very quick to implement a hygiene programming, globally, and kind of forget that we actually know quite a bit about hand washing. People started implementing, mask wearing programs without remembering, we do know a lot about why people behave how they do. And I think the more we can do to make sure that we're learning on kind of the lessons from the past and drawing on our wealth of knowledge around behavior change, it's really going to help kind of future implementation. Next slide, please. So the other area that we are focusing on is sharing what's working. A lot of people have come up with amazing innovations in response to COVID-19, be those kind of innovative approaches to behavior change, to message dissemination, to monitoring and evaluation. So we prepared a whole list of case studies of unique programs that others can learn from. There's currently 35 on the website. These are prepared in partnership with organizations. I think there's another dozen or so more. more. So we're hoping to end with around 50 of these case studies of unique programming. We also have an online map where people can share their own programming. This is so far, we have programs for 109 organizations in 75 countries. And this map has been viewed almost 50,000 times since the start of the pandemic. Next slide, please. And finally, an area where we're increasingly able to kind of contribute here is learning from response actors. We have all of these organizations we have that we're working with. We have all of these programs that we're kind of interdigitized with since the start of the pandemic. And we've been preparing a series of learning briefs in response to this. Unlike our kind of technical resources, which look for guidelines, these are really trying to pull on the lessons we've learned about the pandemic so far and help inform kind of how we're operating now based on challenges and new innovation. So there's a number of these that we have produced and that are forthcoming. We've written one already on hygiene promotion, one on disability and inclusion, one on the challenges and opportunities around monitoring and evaluation for COVID-19 programming, and a forthcoming one on sector coordination. And finally, and parallel to this, we've been implementing a series of in-depth interviews with response program actors. Final slide, please. So that's kind of what we've done so far in the past year. I do encourage you to kind of go to our website. It's hygienehub.info, or email us if you would like more information. We are funded by the Hygiene Behavior Change Coalition through FCDO and the Bill and Melinda Gates Foundation. So thanks, and look forward to questions.
Thank you, Robert. Greatly appreciated. Hugely impressive work. WaterAid is one of those witness working with the Hygiene Hub. One, both sharing our learning, but at the same time also receiving and collaborating in various ways. It was hugely impressive, real-time support, as well as lots of technical guidance and learning, learning case studies, producing case studies, and supporting to the partners to implement a robust hygiene behavior program. Heavily impressive work, Hygiene Hub, well done. Great. With that note, we are moving on. Next slide, please. So we're moving on now. We are moving on to the partnership. So with this, now I'd like to invite Ms. Aarin from Global Handwashing Partnership. She will be talking about the annual think tank event, which was conducted a few months before, and she will highlight some of the recommendation and learning coming from that global think tank event. Aarin, over to you.
Great, thanks so much, Om, and happy to be part of this session. So hi everyone, my name is Aarin Palomares. I manage the Global Handwashing Partnership, and like Om said, I'll be providing some insights and recommendations from a recent event that we hosted back in May called the Handwashing Innovations Think Tank. Next slide, please. So before I get into that, I don't know everyone's familiarity with the Global Handwashing Partnership, but we are a public-private partnership that serves as a global advocate and knowledge hub for hand hygiene. We have nearly 40 partners around the world working toward our joint vision. And through this partnership, we're really able to bring together the collective expertise, ideas, and resources of the public and private sectors to promote hand washing access and practice globally. And so you can see our steering committee members on the screen here, but again, we have a large global network of partners, many of whom are part of this call today. Next slide. So I'll be presenting on our recent Hand Washing Innovations Think Tank. And every couple of years we host a think tank, which is meant to be a closed meeting where we bring together experts around the world to really drive learning and action for hand hygiene. And you can see the think tank objectives on the screen here, so I won't go over them in detail. But for this year's think tank, we sought to answer the question of how do we move forward beyond COVID-19? So imagining the future of hand hygiene, taking into account major shifts in hand hygiene and the progress we've made thus far to come up with recommendations on how to move forward. Next slide. To address this larger question on hand hygiene, or on the future of hand hygiene, we held focused discussions over 5 days in May, and you can see some of the questions we talked about on the screen now. So looking at major shifts and new approaches and reflecting on how that affects our priorities moving forward. We also had more focused discussions. When we were planning the think tank, our task force had determined there's still some major questions and gaps in progress when it comes to forming a culture of hand hygiene and hygiene habits, addressing gender and hand hygiene programs, and also leveraging partnerships for resilience. So during this presentation, I'll try and give some brief insights and recommendations from each of those sessions. Next slide. So we started the think tank by taking stock of the current state of hand hygiene. And in Janita's presentation, she talked about the Hand Hygiene for All initiative, and many of us on this call today are involved with the initiative as well. And so the figure on this slide just reiterates the 4 pillars of that initiative. So a need for robust supply and demand of hand hygiene products and facilities, evidence-based behavior change, a strong enabling environment, and then tied into each of these is the need for strong government leadership. And so I'm sure many of us have taken note of the spotlight hand hygiene has gotten in light of COVID-19, and really where does this leave us now? So we've seen heightened perceived risk lead to behavioral gains for hand hygiene, but behavioral fatigue is very much evident in the midst of a global pandemic. So given all that we know, how do we avoid repeating this for future outbreaks and epidemics? Hand hygiene market systems revealed vulnerability to external shocks, so disrupted supply chains hindered manufacturing of hand hygiene facilities, limited access to raw materials in some parts of the world, inhibited local soap production. But despite some of these challenges and disruptions, the pandemic has also given rise to potential opportunities for local innovations. And then in terms of enabling environment, it's really no surprise that hand hygiene has often been neglected in policy investment and monitoring. Because hand hygiene is cross-sectoral, it can often fall through the cracks in terms of sectoral roles and responsibilities. And so while the majority of countries have policies and plans for hygiene, they often lack sufficient and human and financial resources to implement those plans. And so that really brings up the importance of strong political commitment and leadership moving forward. Right now, we're really at the intersection of urgency and opportunity, and we have this unprecedented attention for hand hygiene and have the opportunity to take collective action moving forward. Next slide. So now that we've taken stock of the current state of hand hygiene, the next day of the think tank focused on this question of how do we build on habit science to continue the momentum for hand hygiene. So unlike reflective or goal-oriented behaviors where you have to think about that behavior before you do it, habits are more automatic, moving behaviors to be more reflexive or unconscious. Due to time, I won't go too far into the principles of habit formation that are on the screen here, but I do think it's important to talk through how we can link these principles with our key takeaways from the think tank. So the first principle is all about ensuring a supportive environment. And at this point, I've been part of several discussions now that have talked about these newly emphasized times to wash hands during COVID-19. So for example, washing hands after coming into your home from the outside. And so there's a need to ensure there are facilities and other prompts to support these new junctures. Likewise, the COVID-19 pandemic has also been a significant context change for many of us. And I think there's a huge opportunity for us to piggyback hand washing with other COVID-19 behaviors. Third principle, eliminating friction. So again, placing hand hygiene facilities in a convenient location and using supportive norms. Providing ownable cues. There was a lot of discussion around nudges during this particular session of the think tank. And nudges are, of course, a type of intervention that place emphasis on choice design. Pure nudges in particular, which are often unconscious and part of choice architecture, can really be used to reduce friction and see that sustainable behavior change. And then encouraging practice through the use of behavioral motives, which are quite different from emotions like fear. So these behavioral motives are more enduring motives like nurture and affiliation. And then the last principle and takeaway from this slide is really the need for multiple interventions that combine all of what I just said to promote meaning and motivation for hand washing for it to stick. Next slide, please. So our next session of the think tank discussed addressing gender gaps in hand hygiene programming. And just to quickly tie back to the last slide and some of those habit principles, it's important to understand where burden falls for creating a supportive environment. Women are often the ones responsible for collecting water used for hand hygiene needs of the household. Likewise, noting piggybacked behaviors like changing diapers or preparing meals that are often performed by women may enforce gender norms. And so there's often this tension between being aligned with gender norms, effective behavior change, and this do no harm when it comes to gender considerations within hand hygiene programs. I think what's important here is to understand that there is a small shift between effective hand hygiene behavior change program that use concept, stories, and emotional triggers that resonate versus harming parents by cementing gender norms. So for instance, guilting or shaming a mother into being a good mom or a good wife. And so I've added some of the recommendations that came out of this session on the screen. I won't read through all of them, But please do take a look, and hopefully the slides will be shared after this. But in general, it's important to build in points of reflection, but also be realistic about what programs can and can't achieve, bearing in mind any sort of unintended consequences as well. Next slide. And so our last focused discussion during the think tank focused on creating shared value and leveraging partnerships. We've already heard from some really great partnerships like the HBCC, and even the Global Handwashing Partnership is a good example of how partnerships can be leveraged. Partnerships can really drive the scale and credibility. They can position partners in a forum to influence policy. And there are also advantages of blended financing and optimizing each partner's strengths and expertise. So for hand hygiene, because it does often fall through the cracks, long-term investment in the coordination, communication, and governance structure of the partnership is really needed. This might require either a funded staff position or at the very least a point person, and of course some kind of accountability mechanism for all partners as well. But ultimately, it's important to set sort of the clear goals and expectations of what the partnership will accomplish and how that partnership can be leveraged to promote more resilient systems. Next slide. So just to close, the think tank was only 5 days in May, but there were a lot of really rich insights, and there's still a lot of further discussion needed for each of these topics. But from those discussions, it's clear that there's a need to really improve knowledge exchange among hand hygiene champions, and we've heard that from our other presenters as well, to really apply lessons learned for future outbreaks. There's also this desire to use this momentum from COVID-19 to ensure lasting behavior change and use it as a catalyst for forming hand washing habits. But if we are to meet our goal of hand hygiene for all, we do have to go beyond the traditional approaches and consider these multiple determinants that impact hand hygiene as well. And so just as an end note, we do want to gather more perspectives. We are very aware of the limitations of hosting a virtual event due to time zones. And then there's also, we are very intentional with keeping the think tank small to make it as interactive as possible. But we do have a couple of different ways to further engage actors as we continue this line of thinking, including some regional think tank discussions. We also have a session coming up next Monday at Stockholm World Water Week. So if you are interested in inputting into some of these questions that we addressed during the think tank, I can post some information in the chat now. So with that, I'd like to wrap up and pass it back to Om. Thanks so much for having me.
Thanks, Aarin, and thanks very much for presenting the outcome from the think tank event. Truly, the global event at that particular time, and also extracting some of the key learnings from those different sessions. Truly appreciate it. Thank you. So now we're going to move the discussion a little bit away from the COVID response, not necessarily fully away, but within the context of the sector, but really shifting the discussion from COVID to more on the social outcomes. For this, we have Dr. Biljana from SEI. She will be presenting the one of the outcome from their work. So they have done the literature review on gender and social equality and looking the impacts of wash intervention. So highlighting some of the insights for behavioral change. So Dr. Biljana, over to you.
Thank you so much. If I can get to the next slide. Yes, thank you. So as Om mentioned, moving to a broader wash and sanitation context, I will present some preliminary findings from a review on gender and social equality impacts of different wash interventions, and we'll try to summarize insights of behavioral change relevance. So I'm working on this review together with my colleague Sarah Dickin, who is also here with us today, and with a couple of more colleagues as well. I have to emphasize that we are also funded by the Center of the Excellence for Development Impact and Learning. Okay, next slide, please. So I believe that findings of this review are important for this group because, as we can see from a couple of points on this slide, most wash and behavior change initiatives are focused on evaluation of health outcomes. And this is also visible in existing synthesis of research on this topic. However, there is not so much focus on gender, education, or other social outcomes, or these kind of synthesis might account for gender only as a contextual factor in design of intervention or adoption, and the existing reviews on this topic explicitly focus on social outcomes are either narrow in scope or quite old now. So behavioral change strategies and initiatives, I believe, can also be designed to increase awareness and to change attitudes and behaviors to promote greater gender and social equality. So with this work I'm going to present, we hope to broaden our thinking to make sure we are obtaining and evaluating the full range of benefits from interventions in the context of behavior change and sanitation and WASH more broadly. Next slide, please. Well, this review is about what works for gender and social equality outcomes, how these interventions that lead to gender and social equality outcomes work and under which conditions. But today we will focus a little bit more closely on the first question. Next slide, please. The scope of this review is that we are mostly focusing on WASH interventions only. So if someone, for example, is studying a general concept of, for example, violence related to poor sanitation, that would not be included in this review. We are focusing, therefore, just only, as I said, defined interventions, WASH interventions that include behavioral change interventions such as health messaging or triggering. We are also focusing on any types of gender and social equality outcomes that we are defining and dividing to inclusive and transformative outcomes. Inclusive outcomes, as we define it, refer to improving access. Actually, as we use it in this review, not as we defined it, refer to improving access and use of WASH for all users, whereas transformative outcomes refer to the ones that are addressing power relations and harmful gender norms that hold us back from achieving gender equality and other forms of social inclusion. And this review is situated in LMIC context and looking at the literature on past 10 years. Next slide, please. So in this slide, there is a kind of a very, very brief overview of the methodology we are applying. This is a mixed method systematic review. However, in the interest of time, all the methodological, I will not go into details of all the methodological aspects of this review, but I would like to ask my colleague Sarah to share the link to our protocol where all the methodological details are explained. Thank you so much, Sarah. You will find this link in the chat. Next slide, please. So this slide shows the volume of information we dealt with in this review. For the purposes of this presentation, I will share the outputs from the initial literature mapping, and you will therefore be able to see just the general trends in the literature on gender and social equality in the context of WASH and behavioral change interventions, and emerging results based on more than 280 included articles. And I have to say that the process of screening as well as critical appraisal and final synthesis is still ongoing, so you can expect some preliminary findings. You can expect findings by the end of this or early next year. Next slide, please. So this slide shows the WASH breakdown compared to different intervention types. The numbers show the number of the articles that we found. So as you can see, behavioral change interventions are seen in yellow, and they comprise a large part of sanitation and hand washing interventions with gender and social equality outcomes. Next slide, please. And most behavior change interventions used health messaging as opposed to triggering. Next slide, please. So this slide shows mapped outcomes or outcome themes that we have so far. And if you click one more time, as you can see, the majority of the literature actually is focusing on the inclusive outcomes. So the outcomes that are about let's say access and use to safe sanitation, hand washing, knowledge of wash, attitudes towards self-wash, but not so much literature so far that we found is focusing on transformative outcomes. So there are limited behavior change interventions that are linked to transformative outcomes that are related to gender or social equality and inclusion. Next slide, please. When we looked at different types of interventions that have a gender or social equality component more explicit, sadly we haven't found much of these kinds of interventions. And usually, most of behavioral interventions do not have explicit gender and social equality component. Next slide, please. Okay, so this, as I said, these are just some preliminary findings, and I would like to conclude this with a couple of lessons so far. So transformative outcomes, as we can see, are less prevalent. There are fewer behavioral change interventions with explicit gender and social equality component. So this is rarely the aim of behavioral interventions. I think perhaps that it's time to think more about the role of behavioral change that can play in gender and social equality within the wash sector. So hopefully with this review, we bring some awareness about these aspects. So yeah, with that, I would like to thank you all.
Thank you, Dr. Biljana. Greatly appreciated. Yes, behavior change is not only for preventing the outbreaks, preventing and suppressing the COVID pandemic or preventing current or future pandemic. It is also for social outcome. It is also for social norms, dignity, and beyond. Very much looking forward for the full findings subsequently. But thanks for the presentation, preliminary presentation. Great. With that note, now we are moving on. So now we are going into the discussion session. For that, to facilitate, I'm going to invite my colleagues, who is also a co-lead for SuSanA Behavior Change Group, Dr. Sarah Deakin. She will be facilitating the discussion session. Dr. Sarah, over to you.
Great, thank you. So yes, I'm also co-leading the SuSanA Behavior Change Group. My focus is more on gender and WASH interventions. So today we heard a lot of really interesting findings and updates about a number of different interventions related to the COVID-19 pandemic, and a lot about rapid changes and adaptations to the rapidly changing situation. And so what we'd like to focus the discussion on today is more about what the implications are of some of these interventions over the long term. So I'm just going to throw out a few questions for you, and then I'll ask the participants if you'd like to give a reflection or a comment to these questions. You can put up your hands or you can put something in the chat. So thinking about the long-term implications of interventions related to COVID-19, but also other types of behavior change interventions you work on, how are you planning to sustain these interventions and resources over time? What kind of systems or institutions or mechanisms are you putting in place to do this? If there have been large investments made, and maybe with the COVID-19 pandemic, there have been some larger investments that might not have been made before, what happens when the funding ends or the funding is cut? How will things be sustained over the longer term? And also one more question that was in the chat is, are you collecting any data, or how are you actually monitoring progress? And so we'd like to hear from those of you working in different areas, whether it's research or implementation or external support. We'd like to hear your different perspectives on some of these questions. So yeah, please feel free to put your hand up if you have some thoughts on this question about thinking about things over the long term and for generations. Maybe I can ask one of the speakers, put them on the spot a bit to comment on this to get the discussion started. Lisa, do you have anything you'd like to add to this question or any of those questions?
Hi, Sarah. Thank you very much. I'm happy to give a few thoughts. So, I mean, as you know, the HBCC, I think I put it on the slide, will come to an end by the end of this calendar year. You'll also know about UK funding in the aid sector, so I won't go too much into that. But basically, the government will go through a spending review, and hopefully after that, we'll have a clearer picture. I just wanted to say that, you know, as the FCDO, we remain totally committed to climate resilient WASH, and also working on climate, you know, within the kind of climate and health agenda more broadly, especially in the run up to COP26. We are committed to making a real change for WASH in healthcare facilities and keeping hand hygiene for all high up on the agenda. I think there are several ways in which we can do that, you know, in the meantime. Partly we still support some of the global water leadership, the JMP, and other such things. But I think the diplomatic and development network will hopefully really allow us as well to move into an era where we're working really on the systems. And I think the things I mentioned, and Janita and Aarin have already mentioned as well, are really critical, I think, to, you know, to maintaining hand hygiene and hygiene high up on the agenda. And also, I think, important to recognise that development aid funding in itself and of itself will not, you know, meet the challenge of ensuring that there's hand hygiene for all by 2030. And so we really need to look to kind of different sources of funding, but also working closely with governments to plan, budget, you know, look at multilaterals as well, and perhaps other types of funding such as climate finance in order to be able to fund these national plans for achieving hand hygiene for all. So I'll stop there. But essentially, a systems approach, I think, is probably one of the ways forward, and we're currently thinking through the future. Thanks.
Great, thank you. Would any of the other speakers like to reflect on some of these questions in terms of the long-term sustainability of the interventions you presented? Maybe Robert, do you have any ideas for your intervention, how that's going to continue in the years to come?
I do, thanks. You know, similar to Lisa, I think the intervention in terms of the hub as its existence, you know, our funding is time bound, so we won't kind of be, you know, our resources are there. I think if we're thinking of this in terms of kind of the generational and long-term aspects, you know, that part of it, I think we often kind of fall into a trap of how do we change behaviors for the generations, where I think we need to start thinking about kind of, as Lisa said, these larger systems changes, these organizational changes that are really going to enable us to implement more effective, more responsive programming, and more and programming that's going to last as well. I think we need to think kind of as a paradigm shift, rather than kind of constantly organizations rushing to implement kind of, you know, single programs, is how can we build better systems? How can we integrate things into these national programs? And you know, and all of these challenges that we're all facing right now. So while I think thinking about generational behavior change, it really is part of the organizational mandates and the broader policy framework that's going to enable that kind of future generations to really achieve hand hygiene for all. Over.
Great, thank you for that intervention. Would any of the participants like to comment in the chat or put your hand up? Julia, did you want to elaborate on that? Or maybe Ziggy, I saw you had a comment in the chat earlier about your experiences. Maybe if you have anything to add on this question. Otherwise, maybe would you like to comment on WaterAid's work and how you're working on this issue from the long-term perspective?
Thank you, Sarah. I think I echo what Lisa and Robert has mentioned. From WaterAid perspective, WAS, including hygiene for everyone everywhere by 2030 is our vision at WaterAid. And we truly believe on universality and all of society approach. We focus on modeling inclusive and sustainable behavior change program and influence government to replicate those models at scale. So if we only work by ourselves, it's not going to be replicable. So how can we work through the right institutional channel, right institutional mechanism to integrate those into existing programming is quite vital. As I said earlier in my presentation, so some of those programs we were already working with the government. Now transition is smooth is because those are government-led initiatives. So what we need is a thorough and rigorous implementation modality to create a proof of concept intervention. Let's not rush to the intervention. Let's create a proof of concept intervention first, working with the government, and then only go for scale implementation. So no regret action. So we need to have this. We need to focus on the strengthening system. WaterAid is that strengthening our system is a central thrust, but it has to be throughout the project cycle while designing, implementing, and evaluating the program. So we are integrating much of our program through existing mechanisms, health, education, nutrition. Some of our program, for example, when I presented hygiene integration through routine immunization program, that program was all about revolutionizing the routine immunization program while integrating hygiene behavior change intervention, building the capacity of the health workers so that anyone visiting the clinic will actually be exposed with the intervention. We focus on improving the sectoral capacity. In fact, through our transformative behavior change program, we have established a mechanism of support for that. So we believe in and are also practicing sustainable behavior over time. So truly focusing on working with the government to have strategy and standards in place. I think some of the initiatives that are currently going on, putting country roadmaps and country financing system is truly a right intervention that need to be done. But we need to model the sustained technological options together with the promotional elements. Let not rush to design. And WaterAid, I think we have learned throughout the pandemic that how can we better focus on sustainable long-term inclusive technological options rather than more temporary focus. Finally, I think our inclusive and sustainable hygiene behavior change at scale and through possible integration with multiple development discourse will definitely contribute in building system that is needed to deliver sustained hygiene behavior change program for generations. Over to you.
Thank you for that input. That's a great comment. I did see someone commented in the chat that political will is an important issue for creating these kind of systems. So maybe I could entice one or two other people to comment or jump into the discussion. I do have some comments coming in to the chat about this. Maybe Aarin, would you like to reflect on this question?
Yeah, sure. I'm happy to reflect. I think we bring a bit of an interesting perspective because the Global Handwashing Partnership has actually been around since 2001. So we're celebrating our 20-year anniversary, and we've long, worked toward this vision of hand hygiene for all. But we also have a very small secretariat, and so we often rely on our partners to do, to produce the research and implement programs. I think of our goal as to institutionalize hand hygiene behavior change for generations. A big part of that is also just getting everyone on the same page in terms of what that means. So that's where I see our role is really that of a knowledge hub and a place for knowledge exchange. Like Robert said in his presentation, there's a lot that we already know, and especially over the last 18 months, there's been a lot of lessons learned. So I think it's important that we continue to take stock and amplify, these behavior change efforts, but then also the best practices in terms of how we move forward.
Great, thanks very much. So if there aren't any, I don't see any hands up unless I'm missing them. So I think maybe
Fanuel Nayaboro.
Okay, I can't actually see that. So maybe if you'd like to go ahead, the person with your hand up.
All right. Thank you. My name is Fanuel Nyaboro. I work with SNV. And we're a partner in the HBCC program. I just want to bring in, just highlight a little bit about what has been said on systems change. I think that's really the way to go, and maybe just to highlight 3 key things that maybe would help in that direction is if implementing these sorts of programs, looking at relevance, coherence, and evidence. And I think with that, you're able to, have programs that are well aligned, and you're able to, get buy-in of government, because government is really critical. And I think, as Lisa had said, that donor funding will not get us alone, to the SDG targets. We need governments to really jump in and play a big role. And like Om has said, working with government and ensuring that there is full ownership is really critical in sustaining behavior change. And so I said that with all this, we need to have good data, so that, when you assess, you're assessing and you can actually bring the evidence, you can actually have course correction and give direction, to the interventions. And just taking an example from HBCC, something that we did in Indonesia and Mozambique, we were trying to make public places safe, and borrowed, what is done in the hotel industry, having a 5-star rating. And just having this kind of a rating in a public place, and trying to get local government to, to assess these places and give them stars and create some sort of momentum that pulls people to adhering to COVID protocols, kind of like gains a bit of traction. And that comes out of just a little bit of a quick formative research and seeing what opportunities there are and what people are saying about the things they're facing. So yeah, just to in a nutshell, I know that time is gone, but just to say that, yeah, when we're doing needs to be relevant, coherent, and we need evidence to drive systemic change. Thank you.
Thank you very much, Fanuel. I think that was a really great intervention, and I think really summarizes some of the important points we've heard today, some of the really interesting and innovative interventions that you've all been working on. It's been really interesting to hear these different perspectives, and I really think that the importance of cooperation and collaboration has really come out today, as well as trying to reach everyone, not just in terms of technology or behavior change, but also making sure the materials that we're producing are accessible to all. And it was also interesting to hear a bit about the importance of gender and behavior change, and looking at that side of things, as well as the importance of systems and systems change when we're looking at how to ensure change over the long term and for generations. So now I'd just like to pass it back over to Om to close the session today.
Thank you, Sarah. Yeah, I didn't have much to add, Sarah. Now I think you have summed up quite well. Just would like to say that, next slide, please. Just would like to say that we'll be sharing the presentation, the full slide deck, as well as the recordings with all the participants in coming weeks. Really would like to appreciate the active participation of all the participants and colleagues. I know some of you are joining from the Asian context, where it's not appropriate time. It's night time for you. Really appreciate for that. I would like to thank all the presenters for your contribution and great work. In particular, I think hygiene has been one of the spotlight throughout this pandemic, but I think the work that has been done in COVID era has been significant, and thanks for all the contribution that your partner and yourself are making, and great presentation and deliberation. And also like to thank the SuSanA Secretariat for helping us to kind of host this event. Everyone truly deserve the rest after this fatigue presentation, long series of presentation, but huge appreciation to everyone for joining, and very much looking forward for the similar type of discussion in future. Yeah, hygiene in action. Thank you, everyone.